You're listening to Soundside. I'm Libby Dankman. Wildfire smoke is deadly and getting deadlier. A recent study published in Nature estimates that if warming continues at the current rate, smoke exposure could kill 70,000 Americans a year by 2050. Researchers expect that Washington state could feel some of the biggest impacts. Some researchers say the study points out some of the strongest evidence so far that climate change is endangering people in the United States. Smoke pollution can cause coughing and throat irritation, but also lead to long-term respiratory and heart issues. The West Coast, in particular, is expected to see the biggest increase in wildfire smoke pollution. So we're bringing you another in our series of Ask a Doctor segments on Soundside, where we talk to medical professionals about the headlines and they give us information about how to stay healthy in our everyday lives. Today, we're talking with Dr. James Wallace. He's a family medicine physician and the health officer for Okanogan County, where they have definitely experienced the changes in wildfire smoke over the years. Dr. Wallace, I really appreciate your time today. Thanks for being here.
Hi, Libby. Thanks for having me on.
So this study suggests that we could see thousands more deaths related to wildfire smoke in the coming years. How has wildfire smoke changed since you began practicing in Okanogan County?
Well, I've been out here in Okanogan County for 13 years, and we're definitely much more aware of its impacts, and we're more prepared for how to respond when air quality does deteriorate. We do better surveillance, and I think we do better education and communication so that people can take actions to protect themselves and their families.
I understand that you had a very personal experience with wildfire, and that had to do with one of the large fires that I think a lot of people all over the state remember from about 10 years ago, the Carlton Complex fire. Do you mind sharing what you went through, you and your family went through?
Fortunately, our family had not grown at the time. My two boys were not yet with us in this world, but my wife and I had recently moved out to Okanogan County, both of us to work in our respective fields. And the Carlton Complex came through, and we lost the home that we were renting. And we're very surprised by the power of this natural force that is unfortunately becoming commonplace. But we were also introduced to the ways that communities respond and the ways that communities prepare and can protect one another. And so, we made the decision to stay and continue to contribute to help prepare ourselves, our communities, my patients, and ultimately be better when the next natural disaster occurs.
I find that really remarkable that you did stay, and I wonder how it informs your practice when you approach issues around wildfire health and safety.
Well, as a family doctor, I'm oftentimes educating and doing all that I can with my patients to prevent illness from happening and anticipating risk and helping patients understand where they rest on the spectrum of risk. And educating patients on how to take precautions themselves. So wildfire smoke is dangerous to everyone, but particularly dangerous to those at extremes of age. So kids, especially kids less than 5, and then adults older than 65. It's dangerous for people that are pregnant, for people that have pre-existing lung and heart conditions, and then people of low socioeconomic status, people that work outdoors, and people that don't have access to clean air spaces or healthcare traditionally. And so that is a large number of my patients and the people that live out in our agriculturally oriented counties on the east side of the Cascades.
There's, of course, the more acute short-term effects of wildfire smoke. What about the longer-term impacts? What sorts of things do you watch for in terms of how exposure can affect people on a longer time scale?
Sure. It's really hard to quantify the impact of a single smoke event on long-term health. It's something that we're working on tracking and investigating. But we know with short-term insults to the cardiovascular system, respiratory system, there is damage that occurs that can have long-lasting impacts. And so we certainly anticipate that asthma, COPD, and other sorts of illnesses that occur in other forms of smoke exposure because of lung scarring and the reactions in the small airways are likely to occur with wildfire smoke as well.
Hmm. So what kinds of precautions do you advise people take these days when there is air quality effects from wildfire?
Yeah, I really emphasize before the wildfire season begins that individuals should understand their level of risk and then what resources are available to them. So individuals can purchase N95 masks that filter particles as small as zero point 0.3 microns, and the wildfire smoke that we measure, the particles are 2.5 microns and smaller. So N95 masks actually do a really good job of decreasing the amount of exposure. People can wear those outdoors or indoors. I teach my patients, and we put out a lot of information about how to create clean air spaces in the home, that is sealing off windows and doors, either in the entire house or one specific part of the house, and then running an air purifier, air filter, or a do-it-yourself box fan filter when air quality deteriorates. It's important for people to know and understand the air quality alert system and what the various levels of poor air quality mean and what precautions they should take at each of those levels. And then they should have a good forecasting app or website or source of information where they can monitor daily air quality and even look towards the next day and the day thereafter to anticipate poor air quality as winds and weather patterns change and smoke blows in from fires farther away.
What is the level of the air quality app number that you recommend folks kind of think twice and start to either wear a mask or to even maybe change their plans to move things indoors, things like that? Like, what is that threshold where you would start to say, okay, at this number, this is when you would say maybe do things a little differently?
Everyone should start thinking about it when it's yellow or between 51 to 100, because it could very quickly change to orange or red where it's more unhealthy and unsafe. A level of 101 to 150 or orange on the AQI scale is the time where people who are at risk and have sensitivity to smoke should begin to move activities indoors and limit their time outside. At 151 or in the red, everyone should limit their time outdoors. And then when it turns purple and then on to dark red or magenta, everyone should stay inside, ensure that they can maintain a safe airspace or go elsewhere to clean air shelters to obtain time in cleaner air.
I don't know if this is your particular area of practice, but I was thinking about this when we had several days just recently in the Seattle area where we had our air quality affected by wildfire smoke. And in the past, it's been extended, weeks at a time sometimes where the air quality is affected. Mm-hmm. And I felt my mood changing over the course of that time. And I was thinking about the mental health effects of all of this. When you do have to stay inside for some amount of time because the air is just not unsafe or unhealthy outside. I was thinking about the effects on kids too, when you have to tell them, you can't go outside to play. I mean, how do you think about the ways that maybe are harder to quantify, but that air quality degrading because of wildfire smokes, it does impact our mood, our mental health?
Absolutely. And, we have studies that show, UW has published work that shows that there is an impact on mental health, behavioral health, that conditions like anxiety, depression, mood disorders worsen during times of poor air quality. And it does affect the way folks think and feel, oftentimes because you're frustrated with a limitation to your activities. But I think compounded by that is the impact that it has on our respiration and ventilation. That a headache, a little bit of nausea, some dizziness really start to impact your mood and the way that you feel. And I have kids, and they are not happy when soccer practice or soccer games or football games get canceled or postponed because of smoke. But it's becoming the norm, and our school officials, our superintendents, talk every Friday afternoon to take a look at the air quality and rearrange games. We've had a cross country meet canceled in our region already this year. So people are thinking about it and making some really tough decisions, but in the long run, for the health of our kids, for the health of our student athletes, it's the right decision to keep them healthy so they can go on to have productive careers on the field.
The thing that started the idea of having this conversation is this research about the additional deaths that could be caused if we don't change course because of increasing wildfires over the next 30 years or so, 20, 30 years. So, we've had kind of a conversation here on more of the micro level about individuals and families and what decisions they can make to try to mitigate this harm. But you're also a health officer for Okanogan County, so you also think at kind of like the policy level.
Mm-hmm.
What can local governments do to try to mitigate this and try to keep people healthier as we are facing this increased risk?
Sure. Still at the local level, it's still about risk mitigation and avoiding the consequences. So we weave wildfire smoke into our emergency preparedness plans. We meet with local employers and encourage them, if they aren't already required, to help their outdoor workers take precautions to protect themselves. And we look towards the future. And when we're building, when we are, building schools or building community centers, ensure that we equip them with HVAC systems and preparedness for wildfire smoke and poor air quality to become commonplace in the future. I think we can then ask that our local officials work with state and national officials to recognize that this is a serious problem, and we need to take more steps to reverse the impacts of climate change and avoid more of the country facing these unfortunate circumstances that we are here in the Northwest.
Is there anything that we haven't talked about yet that you think people should know about this issue?
I think that it's important to recognize that not everyone has the same access to resources to protect themselves from poor air quality. A lot of my patients are outdoor workers and oftentimes have to choose between working in a short growing season where they make the majority of their annual income, to work or not to work on a day when the air quality is really poor. We need to work with employers to support those workers. Oftentimes, people don't have control over ventilation systems in their homes or the quality of smoke preparedness in the places that they live, and so landlords and folks that own housing facilities can do a lot to protect the folks that live in their facilities. I think we can all be really good neighbors and reach out to those who don't have as much access to healthy resources for wildfire smoke. And I think of my neighbors who don't have the same level of knowledge or don't have the same ability to protect themselves and may be at greater risk. And so, like so many other natural disasters, but we want to make sure we're able to help ourselves. But when we're able to, we reach out and help those around us.
Dr. James Wallace is a family medicine physician and health officer for Okanogan County. Really appreciate your time, doctor. Thank you.
Sure. Thanks so much. Have a good day.
Thanks for listening to Soundside. This show is only possible because listeners support us. If you're able to give right now, please check out the show notes for a link to donate. And don't forget, you can listen live on KUOW 94.9 FM Seattle at noon and 8 p.m., Monday through Thursday, or anytime online at KUOW.org.